everyone, I'm Dr. Lila Abbate and I'm a physical therapist. Today I'm going to be discussing postpartum rib dysfunction. Like you had a baby, everything got pushed up, your uterus was all the way up here, your organs were someplace in between, and then now that you've had a baby, things kind of have maybe sunken down, but your ribs don't feel the same. Maybe you started as a 34B and now you're a 40 double D and you're thinking, how did that happen and why is it not changing? So your ribs, the body's a beautiful machine. What happens is that as your organs are being displaced and moving to accommodate this human being that you're making, it's now creating space in between all your ribs. When the baby then leaves, you still have all your rib spaces, but now you didn't train and move them back down into their place. You even may feel that something's stuck. Like, you rotate to the left and it's not moving, or rotating to the right, something's stuck back there. And that can actually happen. Then another thing that happens is that the ribs flare and then they roll up, and then sometimes, your tight t-shirt that you used to be able to wear, now you're feeling like you're just like a cone. My son, he's so sweet. He goes, Mom, you used to be a nice pear and now you're just a banana. Thanks. But right, that's kind of how you feel. You feel like you're this cylinder that you've kind of lost that shape. So if you see on Mr. Bones here, our little, New Dimensions model, your ribs are supposed to be able to stay down. And that happens due to oblique strength as well as rectus strength. When this gets changed, meaning the angle opens, your abdominals, those obliques, don't fire appropriately. So then they're overstretched and they can't contract strongly. So then you can visit a physical therapist in order to help this angle change again and normalize. And doing a lot of breathing exercises where you're just trying to create opening and then a nice closing. And then taking your rib angle, finding where your ribs end, something very functional and easy to do, and keep them tucked. So that when you're sitting in a chair, it's in line with the rest of your pelvis. So that if I kind of did like a pinky and a thumb positioning, if I stand a little, your thumb on your rib could line up with your pelvis, that you're staying in line. So you're not like that, not too much of an arch in your back, and it's not behind, but that you're in line. And that could be just like a little tip that just kind of keeps you recruiting your muscles. You're not going to feel the change immediately. It may take a few weeks, but if you're still noticing that you're doing some work 4 to 6 weeks out after you've been approved for exercise, so now we're like at a 12-week or 16-week mark, maybe it's time to visit a physical therapist and make the appropriate changes.